Welcome back to Dr. Gilbert, Healthy Aging. I am Dr. Gilbert. Throughout my active career as a clinical physician, neurological researcher, and practicing general surgeon, I have spent decades analyzing the exact biomechanical, neurological, and structural root causes of mobility loss in older adults. When you spend your entire professional life inside emergency trauma bays and surgical suites, your clinical eye changes. You stop viewing senior gait instability, hip weakness, and sudden bladder urgency as separate, unavoidable consequences of getting old. Instead, you begin to trace these seemingly unrelated issues back to a single, underlying anatomical failure: the silent, progressive sagging of your pelvic floor hammock. Today, we are shining an uncompromising medical spotlight on a widespread structural trap taking place inside millions of living rooms: the pelvic floor sag and gluteal instability loop. It is a hidden mechanical breakdown that starves your deep hip stabilizers of baseline tension, tilts your pelvic ring out of alignment, forces you into an unsafe, shuffling gait, and creates a continuous sense of hip insecurity every single time you step across your living room floor. Let us sit down together and have a raw, clinical conversation. Have you noticed that when you stand up from your dining chair or sofa, your hips feel unsteadily loose, as if your legs are not firmly anchored to your spine? Do you find that when you walk down the hallway, your body sways sideways, forcing you to take wide, cautious steps just to stay upright? Or perhaps you experience a sudden, overwhelming urge to reach the bathroom the exact microsecond you stand up, a distracting sense of urinary urgency that forces you to hurry your steps when you should be walking with calm, deliberate stability. If you recognized your daily experience in that description, listen to the sound of my voice with undivided attention today. You are caught in an escalating structural crisis. The standard Western habit of sitting passively in soft, deep chairs for hours without engaging your lower pelvic hammock systematically shuts down your primary stabilizing guy wires. Most primary care doctors make a diagnostic mistake. When a senior reports hip weakness or bladder urgency, they offer superficial advice. They prescribe pharmaceuticals for bladder control or tell you to accept hip stiffness as normal aging. Relying on pills or ignoring a sagging pelvic hammock is a total failure of preventative care. If your pelvic floor remains dormant, your deep hip rotators lose their structural anchor, your pelvic ring tilts out of alignment, and your risk of a sudden catastrophic hip collapse multiplies. I did not create this masterclass to leave you in fear. Today, I am handing you a scientifically validated shield of protection, the 10-second chair habit that strengthens senior pelvic floor and stabilizes hips. A simple, safe neuromuscular reset you can perform right on a firm chair to instantly ignite your pelvic floor hammock, lock your hip sockets into alignment, and restore complete physical confidence. Chapter 2: The Anatomy of Pelvic Floor and Hip Instability. To eliminate hip insecurity, stop shuffling, and regain control over your lower body, we must analyze human pelvic architecture through structural engineering, force closure mechanics, and neuromuscular co-activation. At the exact center of your lower skeleton sits your pelvic ring, the central crossroads connecting your upper spine to your lower legs. Stretching across the bottom of this bony ring is a layered muscular hammock known as the pelvic floor, specifically the Levator Ani muscle group. This muscular hammock does far more than simply support your internal organs and maintain urinary continence. From a structural perspective, your pelvic floor serves as the foundational anchor for your deep hip rotators. Directly linked to your pelvic floor fascia is a critical deep hip stabilizer, the Obturator Internus. This muscle travels from the inner wall of your pelvic bowl, wrapping around your ischial bone to attach directly into the top of your thigh bone, the femur. When you are young, your pelvic floor maintains a subtle, continuous resting electrical tone. When you prepare to stand up or take a step, your pelvic floor automatically contracts milliseconds before your leg muscles move. This automated contraction pulls the deep obturator muscle tight, drawing the ball of your thigh bone snugly into its socket, a mechanical principle known as joint force closure. However, after age 70, three distinct mechanical breakdowns occur during prolonged sitting. 1. Passive facial sagging. Sitting for hours in soft, over-cushioned chairs forces your pelvis into a backward tilt. This puts your pelvic floor in a continuously stretched, unengaged position. The muscular fibers lose their baseline elasticity, sagging downward like an overstretched trampoline. 2. Loss of hip joint force closure. Because a sagging pelvic floor cannot generate tension, its sister muscle, the Obturator Internus, loses its anchor. The tight seal holding your thigh bone inside your hip socket weakens. When you stand up, your femoral head slops and wobbles inside its socket instead of gliding smoothly. Your brain senses this structural looseness and instantly tightens your outer hip muscles into a painful, protective spasm. 3. Pelvic drop and the gait shuffle. When you step forward with a dormant pelvic floor, your pelvic ring drops sideways toward the floating leg, a clinical sign known as a Trendelenburg gait. To prevent yourself from falling, your brain commands you to take short, rapid, wide-based steps. You are not shuffling because your legs are old. You are shuffling because your pelvic hammock has lost its electrical connection to your hip sockets. Look at the trap this creates. A sagging pelvic hammock causing hip joint looseness, painful muscle spasms across your outer thighs, and a wide, unsteady shuffle. To break this cycle, we must implement a targeted neuromuscular reset that uses chair-based resistance to fire the pelvic floor and deep hip rotators simultaneously. Chapter 3, the 10-second chair habit, the pelvic hip matrix. Let us now focus 100% of our clinical energy on the concrete, life-saving solution, the 10-second chair habit, known in advanced orthopedic kinesiotherapy as the Pelvic-Obturator Co-Activation Matrix. When older adults notice hip weakness or bladder urgency, the standard advice they receive is, just do basic Kegel squeezes while lying in bed. As an orthopedic surgeon, I must tell you that isolated Kegel squeezes while lying flat are biologically incomplete for mobility restoration. Squeezing your pelvic floor in isolation without engaging your hip rotators fails to train your body for upright weight bearing. It does not pull the thigh bone into its socket, and it does not prepare your nervous system for the physical effort of standing up or walking. We must do the exact opposite. We must execute a co-activation movement, a specialized 10-second habit performed on a firm chair that links a pelvic floor lift with an isometric hip rotation. By engaging your inner pelvic hammock at the exact moment you apply outward isometric pressure against your thighs, you force your brain to fire the Levator Ani and Obturator Internus as a single, unified stabilizing unit. Follow me through the 4 precise, sequential phases of this neuromuscular reset, performed right on your chair before you stand up. Phase 1. The ischial seating anchor, neutral pelvic alignment. 1. Sit on the front third of a firm, non-plush chair, such as a dining chair. Place both feet completely flat on the floor, spaced shoulder-width apart, with your toes pointing straight ahead. 2. Place your palms flat on your thighs. Rock your pelvis forward until you feel your body weight rest firmly on the 2 hard, bony points at the base of your buttocks, your ischial tuberosities, your true sitting bones. 3. Pull your shoulders back and down, lift your breastbone, and look straight ahead at eye level. Taking this posture instantly removes crushing mechanical pressure off your sacrum and aligns your pelvic bowl for optimal muscular engagement. Phase 2. The pelvic hammock lift, Levator Ani re-innervation. 1. Maintain your tall posture on your sitting bones. Take a quiet, gentle breath in through your nose for 3 seconds, letting your belly expand softly. 2. As you slowly begin to exhale through your mouth, visualize the muscular floor resting between your sitting bones. 3. Gently lift this internal muscular floor upward toward your belly button, exactly as if you are trying to stop the flow of urine midstream while simultaneously drawing your sitting bones slightly toward each other. 4. Do not hold your breath, and do not squeeze your gluteal buttock muscles yet. Keep the contraction internal, focused entirely on lifting your lower pelvic hammock upward. Phase 3. The isometric rotation press, obturator force closure. 1. While maintaining that quiet upward lift of your pelvic hammock, place the palms of both hands firmly against the outside of your knees. 2. Take another breath in, and as you slowly exhale through your mouth, actively try to push both knees outward against your hands. 3. Simultaneously, press inward firmly with your hands to prevent your legs from actually moving. 4. Hold this isometric battle, pressing your knees outward while maintaining your internal pelvic floor lift for 5 full seconds. 1, 2, 3, 4, 5. 5. This is isometric outward drive forces the obturator internus to contract aggressively against your lifted pelvic floor, pulling your thigh bones deep into their sockets and locking your pelvic ring in space. Phase 4. The integrated tripod launch, weight-bearing transition. 1. Keep your pelvic floor lifted and your hip guy wires engaged. Hinge forward slightly from your hip sockets, keeping your spine completely straight. 2. Slide your heels backward slightly until they sit directly beneath your knees, pressing both heels firmly into the floor. 3. Exhale smoothly, drive down through your heels, squeeze your buttock muscles, and rise upward into a tall standing position in one continuous, controlled movement. 4. Hold your standing posture completely tall for 3 seconds before taking your first step. Practice this sequence before rising from any chair throughout your day. Why is this 10-second habit so profoundly effective? When you align your sitting bones in Phase 1, you unlock the pelvic ring. When you lift the internal hammock in Phase 2, you reinnervate the Levator Ani. When you apply isometric knee pressure in Phase 3, you trigger joint force closure, drawing the femoral head snugly into its socket. Finally, when you launch in Phase 4, you stand up using a fully stabilized pelvic frame. In just 10 seconds, you transform a loose, unsteady hip joint into an anchored shock absorber. Chapter 4. Clinical Dosage and Living Room Errors. To achieve permanent pelvic and hip stability, you must execute this protocol with daily clinical consistency. Here is the biological adaptation timeline you will experience. Week 1. Neuromuscular awakening. Within 7 days, that loose, insecure feeling in your hips upon rising will diminish significantly. Rising from a chair will feel lighter, and your initial walking steps will feel remarkably more grounded. Month 1. Fascial remodeling. After 30 days of daily consistency, your pelvic floor regains baseline resting tone. The deep rotators hold your femoral head securely inside its socket, eliminating outer hip pain and reducing sudden bladder urgency. Month 3. Total pelvic sovereignty. After 90 continuous days, your nervous system overwrites old, unsteady gait patterns. Your pelvic ring remains stable during single-leg stance, granting you complete physical confidence on all surfaces. 3 deadly everyday mistakes destroying senior pelvic stability. Slouching on your sacrum in soft furniture. Sitting backward on your tailbone stretches the pelvic floor into total dormancy. Always sit upright on a firm surface using your true sitting bones. Standing up with knees collapsing inward, allowing your knees to knock together when rising deactivates your hip rotators and strains your pelvic floor. Always keep your knees aligned over your ankles. Rushing out of chairs while holding your breath. Nictitating or holding your breath spikes thoracic pressure and pushes your pelvic floor downward. Always exhale smoothly throughout the rising movement. Chapter 5. Reclaiming your mobility and sovereignty. Reaching your 70s, 80s, or 90s is an extraordinary milestone. It should be defined by personal freedom, wisdom, peace, and joy, not by physical restriction, hip insecurity, or fear of losing your mobility. Hip weakness and walking unsteadiness are not inevitable consequences of aging. They are mechanical puzzles of dormant pelvic muscles and unanchored hip sockets. Today, you possess the exact clinical blueprint to solve that puzzle. The next time you prepare to stand up from a chair, do not rush. Take 10 seconds. Align your sitting bones, Lift your pelvic hammock, execute your isometric press, and rise into space with absolute vertical stability. If you found today's masterclass valuable, share it with your husband, your wife, your siblings, and your friends. Let us protect the physical independence of our seniors together. Thank you for your time and trust. Subscribe to our channel, honor your physical temple, practice your daily 10-second chair reset, and step forward into your day with absolute, magnificent power.